Efficiency Unlocked is hosted by two tech-savvy physicians and dear friends of mine, Doctors Adam Karu and Dale Gold, who are experts in using technology to automate routine tasks and increase efficiency in everyday and business life. Let's see what they have for us today.
Stay tuned for this series of episodes where we'll be discussing the game-changing impact of AI in the realm of patient care and physician well-being.
Get ready to unlock efficiency with NerdMDs.
Efficiency Unlocked.
We have this belief that people enabled by AI, we're going to drastically improve the quality of care, decrease the cost of healthcare, and ultimately provide a better experience for everyone, for patients, for families, for clinicians, for every healthcare worker.
Hello and welcome to this week's episode of Efficiency Unlocked, the podcast where we explore how technology can unlock new levels of efficiency. In this week's episode, we continue our AI series, and today I have a very special guest with me, Nikhil, the co-founder and chief scientist of Ambience Healthcare. Nikhil has a fascinating background in AI research, drug discovery, and tech-enabled primary care. And in this show, he will share with us his personal journey, his vision for Ambience, how his company is using generative AI to automate documentation, coding, referrals, and patient instructions for clinicians across all specialties, and why he believes their product differentiates from the pack. I hope you enjoy this episode. Thanks for listening. Nikhil, welcome to the show. Appreciate it.
Thank you for having me. This is a pleasure.
Yeah, that's awesome. So let's start off with you giving a little background on, why you got into this, kind of that your story of your why. I think that's really important to understand why people get into these roles and start these ambitious ideas.
Yeah. I think my journey through healthcare, it started off with my own personal experience with the healthcare system. I was actually born with several severe heart problems, ended up with sepsis several times as a kid. And so I was constantly inside of the healthcare system receiving care. And my parents immigrated from rural India. So you could imagine the world they came from. They didn't really understand how the healthcare system worked in the US. They didn't have insurance, like all these things. And so on the one hand, you look back and you're like, well, the only reason why I'm alive today is because of the miracle of modern medicine. And yet you also see what it put your family through and the tremendous cost that it came at. And so you go through that set of experiences, I think, as a kid, and it's just hard to not want to work on healthcare in some way, shape, or form. And so I originally thought my path into medicine was going to be as a clinician scientist. I spent about 8 years doing research at San Jose State, at Stanford, some incredible institutions, and I got to work with some really amazing people on drug discovery, on vaccine design, on some stem cell biology, and then I think the event that just threw a whole wrench in my vision for how I wanted to work in healthcare was my first mentor, who was almost like a second mother to me, ended up passing away. She had a mischaracterized sarcoma. She was on the wrong care plan by the time they realized it metastasized to her brain. It was one of those things where it wasn't necessarily the limit of our knowledge that was the reason that happened. And so you start to reevaluate a lot of the reasons why and how you want to contribute to the field. And around this time, I ended up at MIT. I met my co-founder, Mike, and he's got his own crazy story. He fractured his back. He was misdiagnosed. He had to navigate the complexities of our healthcare system just to end up back on his feet, quite literally, especially after being told he may never be able to walk again. And so from those sorts of experiences, I think we started to realize that maybe the right way for us to refocus was how can we leverage technology to better support the stewards of our care? And we just had this really incredible opportunity being at the right place at the right time. Around 2012, 2013, there was this big explosion in AI. And Mike and I had this incredible opportunity to be at the ground floor with some of the foundational research groups. One of our mentors, an investor now across two companies, this man named Jeff Dean. He's the chief scientist of Google today. He built an organization called Google Brain. They invented the transformer architecture. And we've already seen how that's transformed how we think about AI through large language models and ChatGPT. Sam pulled me in the early days of OpenAI back when it was still a bunch of researchers hacking in Greg's apartment. Obviously, we've seen that organization completely explode, and Ambience is OpenAI's first investment ever as an organization. And so, Mike and I were sort of seeing this happen, and we could see the writing on the wall that this class of technologies was going to change the way we work, and especially in healthcare. And just given what we had gone through ourselves, it was obvious to us that this is where we wanted to dedicate our careers. And so in 2020, Mike and I officially started Ambience, and the goal was to build this AI operating system for healthcare. To give every healthcare worker AI superpowers. I think we have this belief that people enabled by AI, we're going to drastically improve the quality of care, decrease the cost of healthcare, and ultimately provide a better experience for everyone, for patients, for families, for clinicians, for every healthcare worker. And coming from Silicon Valley, we've already seen this start to play out in other industries. In software development, for example, we are already seeing AI have this kind of impact. The engineers at Ambience today, they're writing code at 2x the speed because they all use an AI copilot. And that leverage ratio is only increasing over time. They get to spend more and more of their time thinking and architecting. They're not writing the software plumbing they used to have to. And so that's an incredible opportunity. And I think if you look at healthcare, the reality is we need these kinds of copilots for our healthcare workers. You just look at the rising costs. I think over the last 20 years, it's gone from 13.3% of GDP to now 17.3% of GDP. Especially after COVID, our healthcare workers are already overworked. People are spending hours and hours after work on weekends trying to keep up on documentation, the medical record, and all sorts of other administrative tasks. And I think structurally, we have a problem because this trend is only getting worse. If you look at just our aging population, there's 11,000 seniors aging into Medicare every single day. So the current trajectory is unsustainable. And in our eyes, the only way to get out of the square is if we can harness AI safely and responsibly to unlock new kinds of productivity to truly move the needle on cost and quality and experience. So that's why we started Ambience.
No, very cool story. I mean, going all the way back from your parents immigrating here to, some of those health issues. I hear this a lot, on this show, and obviously just meeting others, how much something that happened to either you as an individual or your family, really kind of dictates the future. And, obviously in your case too, reflecting back on part of your story, being in that place where some of these technologies now that are so kind of mainstream, and have flourished over the last year plus in the public eye, you were talking about these and seeing kind of this future state way back, then, which is impressive. I think I always tell the physicians that I work with that, there'll be a day where we'll get back to the heyday of medicine, where you don't really have to write down stuff. You just need to go into the room, interact with the patient, figure out what their problem is, help come up with, a plan, get them back on the path. And it's, like you said, I think all of these different AI kind of co-pilot type technologies are what are going to ultimately enable that. And we're starting to see that in real life now, which is really exciting.
Yeah, no, 100%. And I think, very lucky. Much of our team has worked on the foundations of this research for the past decade. And that's across large language models, across speech rec, across self-driving cars. And I think the reality is all of those lessons we've learned in the last 10 years is ultimately going to be the foundation, the cornerstone of how do we build AI that can be used safely and responsibly in a way to actually create leverage for our healthcare workers. And so I think in many ways we're lucky to have had that head start. But ultimately the only thing that matters for us is can we create that leverage for our healthcare workers?
Yeah, no, I love that. I think let's talk, you started to talk a little bit about Ambience, and I'd love for you to kind of give some kind of more kind of nuts and bolts to what Ambience is, really along the impact of how, it's using these transformer models and different generative AI components to really, hone in and decrease that administrative burden and help fight kind of burnout that is, obviously rampant. And then, if you can share a bit more about that, like kind of the impact of your product over the last few years and where it is today. And then, if there's even an example that you can kind of share of, of a story you've heard of someone who's used Ambience, I think that would be really fun to listen to.
Yeah, no, of course. I guess on the highest level, Ambience is almost a suite of synergistic AI tools for healthcare workers, and we've started off with the clinician. And we started the company with this thesis that AI is just a tool, and tools are only as valuable as the problems that they're used to solve. And the near universal hair on fire problem that we settled in on in 2020 was just how much time clinicians were spending on EHR documentation. And I think the little anecdote that I skipped was Mike and I actually spent 4 years running a tech-enabled primary care group. And so we actually hired clinicians, we treated patients, we just built this deep, visceral understanding of the pain of clinical documentation because we saw our docs burn out, we saw our docs turn over, and we tried everything we could to try to solve the problem. I think the statistic that was so staggering to us was, as a country, we actually employ 100,000 human scribes to do documentation on behalf of our clinicians. That's over $4 billion per year. And yet, despite all these efforts, scribing programs are really hard to scale. Because if you think about it, most folks who choose to pursue a career or a job as a scribe, that's a stepping stone to something bigger in medicine. And so all these organizations, you're on a constant hamster wheel trying to identify, train, retain talent. One of our customers is UCSF out here on the West Coast. And they've spent almost a decade, I think, trying to bring scribing support for their clinicians. And despite having the budget allocated, the vast majority of clinicians actually still don't have a scribe. And so that's the reality of the problem. And so that's what we set out to solve on day one. We thought that was going to be the killer first application of this class of technologies. And I think one of the things we learned very quickly trying to get this to work was quality, reliability, usability were paramount. And the insight that I think a lot of folks are starting to appreciate now, but we had to wrangle head on in 2020, was that the product almost has to be thought from the ground up, rethought from the ground up for every single specialty. And part of that is if you think about each of these environments, for every specialty, the workflows are different. The medicine that's being practiced is different. The care models are different. Just compare the oncology workflow and documentation to a primary care note to what happens in the emergency department. If you don't get those details right, if you aren't customizing for those specialty-specific workflows, you end up in a position where the product is maybe unusable. Because, for example, in an ortho practice, you're moving from room A to room B to room C back to room A. So if you can't interleave patients, the product's unusable. If in an oncology note, if you don't do a good enough job of capturing the activities of daily living to document the ECOG status for the patient, then the clinician has to come back and write all that detail into the note. And so what we started to see was, you could get a pilot with a couple of demos, but ultimately what ends up happening is if the user experience is clunky, if you're not integrated properly into the medical record, if the notes aren't high quality enough, then a clinician may pick it up, try it for a couple of shifts. Ultimately, they can't adopt it and they drop it. And we've just seen left and right pilots kind of drop off in less than 6 months. So that's why for us, I think the principle we've kind of leaned into is chasing the nth degree of perfection and doing it by specialty. And I think now the result is we're saving clinicians just using AutoScribe alone between 10 to 15 hours per week on EHR documentation, which is a staggering amount of time if you think about it. And that's not a cherry pick stat. That's across every single ambulatory specialty and subspecialty, including at institutions like UCSF, where you can imagine the range of medicine that's being practiced. We're lucky now to be working with some of the leading sort of players in the U.S., some of the largest ambulatory provider organizations like Pediatric Associates, the largest pediatric player in the country, GI Alliance, the largest GI group in the country, the Oncology Institute. They're the largest value-based care oncology group in the country. And then also a number of major health systems, and the ones that are public. We've talked about UCSF. There's John Muir Memorial Hermann in Houston, Texas, St. Luke's, and a number of others that we haven't yet announced. I think for us, the frontier is actually some of the most challenging settings in the health system, where none of the other players are even close to having a solution. For example, the emergency department. It is a wild environment to try to operate with paramedics rushing in, the complexities of suspecting workflows, the fact that you have to do time-stamped documentation for critical care requirements, fracture care, all these things. You might have specialists consulting sometime in the middle of the visit. All these things you have to be able to manage in the context of the pace at which the ED moves. It's also the place where we hire the most scribes. I think one of the exciting things for us is in December of last year alone, we actually did 500 visits in a level 1 trauma center. And that's rapidly accelerating for us. I think it's become such a trusted sidekick for clinicians. We're just part of every single shift and almost every single visit that they've started to name it. I think one of our early psychiatry groups named it Janet, after Janet in The Good Place. I think they call it Harold at John Muir. I think at Pediatric Associates, they've named it Bambi because
I love it.
The visit. And
very cool.
That's been kind of incredible to see. And I think the most important thing is clinicians are going home on time. Like, you're saving so much time. They're going home on time. They're not documenting after hours. They're not documenting on the weekends. The other thing too is, you get such a richer interaction with the patient. You get to spend more time with them. You're not rushing at the end because you've got a note to finish at the end. You're not multitasking in the EHR. That gives you more time to close gaps in care. I think, things like smoking cessation counseling, things like doing talk therapy in the middle of a psychiatry visit, things like having those palliative care discussions and shared decision-making around your care options in an oncology visit, all those things that if only you had more time, you would do. I think clinicians all over our customers are sending us letters every single day, sending their CMIOs, their executive teams letters every single day. They really feel like it's brought the joy back to practicing medicine, and they feel like they're, for the first time in a long time, they can really do their best work on a day-to-day basis. And so that's been exciting. And I think now that we're part of every single visit, it's opened up the possibility for us to build an entire suite of additional products that continues to add more and more and more value, from after visit summaries for patients and their families, improving handoffs between primary care and specialty care. And last year, we also released our CDI product, Auto CDI, and that's been huge for organizations. And so it's been quite special to kind of see how quickly that's played out over the last 24 to 36 months.
No, it's great. I was just going to ask about what are some of those other components. So I appreciate you describing those, because I think, right now it's a bit of I would say there's a bit of a heyday on just like the ambient documentation, but this technology has the ability to help a lot of other things, and as you mentioned, that's the way you see the vision of this company, is being that kind of ecosystem that can kind of help all healthcare workers, eventually across the map. So I guess the next kind of phase I'd love to get into is, you've alluded to this, I think, with several of the, your comments so far, but can you talk, kind of get into some of the specifics where you feel that Ambience is truly differentiated, from others in the market? And, and then if you're able to give us a glimpse of into the future, kind of even like where you see this expanding, I think that would be, it'd be interesting to find out that info.
Yeah. We talked a little bit about Auto CDI. And if we take a step back, I think the higher level principle that we kind of lean into as an organization is, how do we use technology to make doing the right thing obvious? And how do we use technology to make doing the right thing easy? And I think the combination of AutoScribe, our scribing product, and AutoCDI, our CDI product, is almost like a elegant case study of that principle. So on a high level, AutoCDI is essentially an intelligent coding assistant. And what it's doing is listening to the conversation alongside AutoScribe and thinking about what are the appropriate ICD-10 and E&M codes that are relevant for this particular visit. Obviously, that's critical from a compliance perspective. It's critical from a reporting perspective. It's critical from a reimbursement and rev cycle perspective. And if you're taking on risk, those ICD-10 codes are associated with HCCs. Obviously, the whole migration to V28 is a nightmare for a lot of folks. Thinking about, do I code by time? Do I code by complexity? Do I use a modifier 25? Does this qualify for smoking cessation counseling? Does this qualify for a talk therapy add-on code? All these nuances. Clinicians don't want to remember these rules. This is not what they went to train for. It's a distraction from actually providing patient care. And so AutoCDI is almost the opportunity for us to take care of that responsibility on behalf of the clinician. Documentation and coding are also inextricably tied. And I'll give you an example of what happens when you separate these two processes, which we do today, right? If you think about how these processes work today, a clinician documents in the EHR, and sometime later, if you're lucky, you might have an ambulatory or an inpatient coder look at what's documented and try to make the most of what's written down. But let me paint a picture for you. Let's say you're a pediatrician. You've got a child come in for their annual well-child visit. But it turns out they've got some other acute complaints. Maybe there's an ear infection going on. This is a pretty common occurrence.
Very common.
And right. And so very quickly, this becomes a complex well visit with a sick component. And as a doc, you may or may not know this off the top of your head, but the right thing to do is you've got to use a modifier 25. And then you've got to have two separate sets of documentation, one for the wild child component, one for the sick visit component. But even if you know this is the right thing to do, the reality is you're probably running behind. And there's just no way you're going to be able to write these two sets of documentation. So the way the system is set up, you're even if you had a back office audit or a CDI team, if they looked at what was written in the medical record, they would have never even known that there was a sick component to this visit because it would have never been written in the first place. But today with AutoScribe and AutoCDI, you have these things working in concert, recognizing the opportunity for the modifier 25, automatically generating both of the documentation, pushing those directly into the EHR seamlessly. And so all of a sudden, there is your positive ROI. And you didn't have to ask your clinicians to do any more work. And I think that's really special. Last year, we had an opportunity to be part of this discussion session with major health system executives. And it was pretty helpful to witness the stark contrast that you see between marketing and the reality of what's playing out on the ground. And there was a question that was posed to the audience in a room full of 50 CMIOs. They asked, who's seeing positive ROI from their generative AI implementations? And the reality is, in this macroeconomic environment, it's impossible to justify investing resources in something that isn't going to have a positive ROI. And yet, in that room, not a single CMIO who wasn't working with Ambience said that they had positive ROI on a generative AI investment. That's wild to me.
Yep.
And it's also not tenable to ask your clinicians to see more patients to pay for this technology, especially you look back, like what we put them through COVID, you can't ask them to see more patients. That's just, it's too much to ask. And so the question naturally is, where does this ROI come from? And I think actually it's in being incredibly thoughtful in how do we enable doing the right thing more easily without having to ask a clinician to do more work that comes out of it. And this phenomenon that we just talked about, in the hospital setting, one of our customers actually has estimated that because their coders don't have a really clear sense as to what's happening in the visit during an encounter, that they're losing somewhere around $26 million in opportunity for revenue because of the impact it has on their case mix index. And that's just the CPI world, right?
Yeah.
If you think of all sorts of other processes inside of a health system that have huge economic implications have the same structure. Utilization management has the same structure. Prior auth has the same structure. Clinical trial matching has the same structure, where you've got some center of excellence elsewhere trying to review post facto, when in reality, those decisions should be happening in concert with documentation at the point of care. And so that's sort of the elegance of Ambience's operating system approach.
That's great. That is great. What, where do you think, this could be a general question. Where do you think like this capability and technology set is going to be able to go in kind of the next wave, beyond what we're currently seeing? Do you have any thoughts on that?
Yeah, this is a great question. These capabilities are rapidly accelerating. And our team has an opportunity to almost peek into the future a little bit. We know what's coming in the next 12 to 18 months. And that's, for us, it paints a very exciting world. We talk to health system leaders, and the more and more health systems we talk to, the more and more it's obvious to us that you don't want a myriad of point solutions, right? It doesn't make any sense for you to have one solution for your primary care docs and a totally different solution for your oncologists and a totally different solution for ED. So that's table stakes. It also doesn't make any sense to have one solution for your doctors and one solution for your nurses. Like, those should be the same brain. And given what we just talked about around coding and documentation, it also makes no sense to have one solution for your coding system and a totally different solution for documentation. In an ideal world, what you want is a single shared brain that learns across every single touch point across the entire continuum of care, powering better decision-making, power better clarity and better transparency for the entire system. That's that's not science fiction. Given where technology is going in the next 12 to 18 months, that's very much the reality of where this is going, as long as you have the right team of clinicians collaborating with world-class AI researchers to build best-in-class experiences for health systems. Building that and maintaining that shared brain is incredibly hard, right? Because if you think about it, it has to deeply understand the medicine behind every specialty. It needs to keep up to date on all the latest clinical guidelines. It's got to understand the safety protocols, all the changing coding and billing rules, regardless of how they change by payer, by region, by contract type. But I think once that exists, right? Once that foundational, capable AI medical brain exists, it's going to be extremely valuable. In fact, you can almost think about it like an indispensable industry utility now, right? And that's something that will power a lot of intelligence behind how we want to support our healthcare workers across the industry. And then the question is, once this utility exists, how do you want to use it, right? And we're already seeing it internally at Ambience how much more rapidly we can build and ship solutions, like how quickly we shipped after-visit summaries, how quickly we shipped the ability to improve handoffs and referrals between specialties, how quickly we were able to build the CDI product and generate real value for the organizations we work with. But I think there's a version of the world where Ambience keeps that closed and internal. I don't know if that's the right thing for the ecosystem. In fact, you think about the ecosystem today, it is already fragmented, and we talked about so many of the structural inefficiencies that come out of that fragmentation. And that feels like a suboptimal world to be pushing towards. But it's also quite closed. As a health system leader, you don't have a lot of agency to pick the best possible solutions for your organization, just because these systems don't talk to each other and they don't really want to talk to each other. And so even if you had teams internally that had the capability to build, it's pretty hard to build on top of your IT infrastructure. And if you just think about this from the consumer world, it's almost unfathomable, right? Imagine buying an iPhone and all you could use were Apple apps, right? You only get Apple Maps, no Google Maps. That would be unimaginable. And yet that's the reality that healthcare systems have to work within today. And so if you're thinking about, well, what is the real unlock for an institution to move the needle on cost and quality and experience? Well, I think part of it is freedom of choice. And that may be one of the more exciting opportunities for an intelligence layer like Ambience, because once you have this really powerful industry utility, you've got the pipes to read and write data out of systems of record. Then it makes it very easy for software developers from our EMR partners, for health system IT teams, for other ecosystem players to really readily build intelligent applications on top of this infrastructure and inject intelligence at various points of care. And some of these applications may have been really, really hard to achieve adoption for before something like Ambience, right? Because let's say you've got a really powerful AI diagnostic support tool for cardiology, but it's only relevant for a small subset of arrhythmias. Well, that may not be a tool that gets used often enough to build the habit of being adopted into workflow. But all of a sudden, the contextual awareness of the engine allows us to identify the right app and the right intelligence to inject when to which clinician for which patient at the right time. And that's pretty special, I think, if we can kind of work towards that more unified open ecosystem. That's a future worth building towards.
Yeah, no, I love that and completely agree. I feel like there's we always try and make these connections between kind of healthcare and then our consumer worlds. And there's so many examples of where, it's obviously more complicated in healthcare because you're dealing with a lot more kind of privacy and things, but we have to work towards that and get to that state where we can have, where we can incorporate these technologies easier and simpler. Because you're right. I mean, it's somewhat monumental many times to just even get a small kind of single use case solution into a system. So no, you're spot on there. No, this was a great conversation. I think I always love to give our guests, a kind of 1 to 2 minute window to say, how would you, if you bumped shoulders with another health system, executive or leader, if you had that 2 minutes with them in the elevator going up a skyrise in New York City, to give a quick pitch on why they should consider Ambience, what would you say?
Yeah. I think what I would probably say is Ambience is a single unified generative AI platform for all your specialties, all the way from primary care to psychiatry to oncology for your emergency departments. We've developed an ecosystem of products that leverage a single shared brain to automate ambient documentation, coding and compliance, referrals and handoffs, after-visit summaries for patients and their families. Today, we work with some of the largest ambulatory provider organizations and leading integrated health systems, and on average, we drive a 5 to 15x return on investment for our customers, largely because we've pursued the nth degree of perfection by specialty to make sure we actually cater to each department's unique care model, all of their workflow quirks, and all the coding billing requirements. We're also rapidly adding products to our ecosystem so we can leverage that same shared brain to supercharge all your other workers, including your nurses. And ultimately for us, the vision is, let's create this open set of infrastructure powered by the most capable foundation models in healthcare to give health systems greater control and choice as you think about how should this class of technologies be implemented within the organization.
Awesome, Nikhil. That was spot on. That was actually a little bit less than a minute even. So you got that honed. And I mean, you guys are going after a great vision and really executing on this. So let's wrap things up with the kind of the fun round. This is where you get to relax, stop thinking about your company. And I just want to ask you a few fun questions in this like nerd alert lightning round, to know a little bit more about you. Sound good?
Perfect. Let's do it.
Awesome. So, I mean, the obviously the impetus of this podcast is all around kind of unlocking efficiency, and obviously what you just explained for the last 30 minutes or so is clearly fitting that. But in your personal life, is there something that you feel like you could not live without right now, personally?
It's a good question. I've got this almost daily routine. Starting a company is not incredible for health and fitness, but I've got this elliptical that it's just so it's been instrumental to just staying on top of health because you can hop on, it's easy on the joints, and I can take meetings, I can take calls. But I think that's probably the one thing that I couldn't live without. Like I need my elliptical, otherwise I'll probably shorten my lifespan by 20 years by not getting enough exercise into my routine.
No, that's clutch. That I recall back, I had a couple orthopedic injuries. After college, I was still playing kind of basketball for fun and a little bit of competition and had a few and realized those days were numbered. And so I don't know, probably about 6 years ago, we ended up getting a Peloton cycle, in our house. And same thing, if that thing breaks, like I freak out, and thankfully it hasn't broken, but it's the same. I hear you. It's exercise is medicine. And when it's convenient and you can do some stuff, it's key. No, it's great. I love that your elliptical is not just a glorified clothing rack, which I think sometimes they turn into.
It used to be, but 2024 I've turned it around.
Nice. Awesome. What's the most interesting place you've ever visited?
It's a good question. I'll be honest. Given what we went through growing up, traveling has not always necessarily been something that we've had the opportunity to do until quite recently. I will say, going back home to India has always been kind of a stark experience. Especially just comparing, it's not like my family and I had an easy time growing up here in the US, but I think you see a real poverty when you go to India. And so that's to kind of see how stark quality of life and how that can have an impact on someone's health and someone's well-being. I think that's probably the biggest. I wish I had a more interesting answer to your question. I think
no, that is
very much.
No, that's a very interesting answer. I mean, and it's relevant because the question really was just the most interesting place, not necessarily a positive or a negative, or just one of those places that has struck you. Do you have any hobbies outside of work life that people may not know about you?
I like to write. I did pick up a creative writing degree actually when I was in college at MIT, and at some point in life I will probably in retirement go to film school and work on screenplay. I love Korean drama. Has gotten very, very big recently. I love Korean drama. I love sort of that slow burn romance kind of storytelling, and so maybe sometime later in life I'll write a TV show.
That sounds awesome. And I actually hear that from a lot of people that are either in medicine or another scientific kind of profession. They have this kind of passion for creating. And it's the reason why we started this podcast. Same reason. It's fun to create, and it's fun to do something that's a little bit outside the box of your normalcy.
I think for the docs actually listening, Hospital Playlist, I would say, is an incredible TV show that kind of just really highlights some of the beauty of choosing a career in medicine. So if there was one TV show worth making time for me, that's the one.
Cool. No, good recommendation. So last question. If you could have dinner with anybody, alive or dead, who would that be and why?
Oh man, it's a good question. I've been asked this question. Probably last time I was asked this question was probably in college, and a lot's changed since then. So
it's interesting when you have to kind of reflect, huh? Because I think as you go through life, the way you would answer that question probably changes. I
think I probably want to talk to Steve Jobs. There was something incredible that he built, both in terms of the impact that it's had on the world, and also just a organization of such longevity, even beyond his passing, and just better understanding sort of the the DNA that went into that. I think it feels like there's a set of lessons there to learn from. I think it's hard to argue with how much of an impact Apple's had on our society. And I think, someone trying to build a company of significance today is probably a lot to learn there.
Completely agree. I mean, he's one of those kind of ultimate rarities, that could not only see kind of a future state, he could see like the future state well before, I think a lot of us kind of mere mortals can do that, or pretend to do that. Well, awesome, Nikhil. I really appreciate you taking your time out, and super excited for you guys, and obviously wish you guys the best of success. I think the coolest thing about all of this, and again, all the different companies that we've talked to and founders, and it's like everyone's on the same boat. We're all trying to fix that fundamental problem. So I really appreciate you spending time talking to us today, learning a little bit more about you, and more about Ambience. So best of luck in this 2024 year ahead.
Thank you. Thank you for having me. This has been such a fun time.
Awesome. Take care. Thank you for listening to Efficiency Unlocked, Nerd Tested, MD Approved, a Nerd MD's podcast by Drs. Adam Carew and Dale Gold.